16-year-old Severin is enjoying a short break at a group therapy session at UCLA. He has earned it. Severin is suffering from obsessive-compulsive disorder. He is here to regain control of his life.
There wasn't really anything that really started it. It just came out of the blue, really. These thoughts just keep coming over and over, and I was doing compulsions, and I didn't know what it was.
Severin is a star athlete, a cross-country runner, college-bound. But without warning, he began having persistent thoughts of hurting himself, though he was not depressed or suicidal. OCD patients like Severin often attempt to reduce or prevent the anxiety caused by persistent, irrational, intrusive thoughts by performing rituals or repetitive behaviors.
My mind would tell me not to step on cracks or not go over the line when I would write in homework, or I couldn't do anything in threes.
Severin couldn't use a black pen, wear a black shirt, thinking it would make his fears of hurting himself come true.
Normally he was a pretty happy child, and so we couldn't figure it out. It just seemed so bizarre.
Looking for answers, Severin's family sought out UCLA's new pediatric OCD intensive outpatient program.
I think without knowing that there's this thing called OCD and other people have it and it's an actual discrete disorder, he just felt like it was just him and he was going crazy.
In this new intensive outpatient program, Severin will come 4 days a week for about 3 weeks. It is complex therapy, including education and what's called an exposure and response prevention technique.
What we do is expose the child to the feared situation. They learn that nothing bad's going to happen, and they gradually habituate to the fear. So the fear lessens.
What's your anxiety level now?
About a 5.
Good.
Severin, because he was afraid of overdosing on pills or hurting himself with a knife, the exposures that he has at treatment are he's in a room with a knife or he's in a room with pills. I believe the best way to treat it is with some type of intensive program.
Behind UCLA's established and highly effective OCD programs, researchers here are looking for causes of the disorder, developing new medications and treatments.
The UCLA OCD program is very well respected, and people come from all over to come here. We're really at the cutting edge, both with the research that we're doing and the treatment. So we're applying all the new knowledge.
Severin's family and doctors granted us privileged access to share this life-changing journey. Along with medication, he is facing down his greatest fears and developing coping skills that will help him for the rest of his life.
I notice a pretty big difference from when I first came here to now. I am realizing that I'm not going to hurt myself. I don't want to. I don't have any intentions of hurting myself, and that those are just thoughts, and
the thoughts would just
I know how to manage the thoughts a lot better.
I didn't know how intense it was going to be, but I have to say it worked. And now he has gone through all of his compulsions. He's wiped them out, and so very proud of him because it's been hard work, but he's done a great job.